you very much for joining us today on this beautiful autumn day. My name is Lori Marie Peixoto, and I am the Outreach and Education Coordinator here at NeedyMeds. Today we have a very special presentation. My colleague Evan O'Connor will talk to you about Healfundr, which is a project from NeedyMeds, crowdfunding your power to heal. Before we begin the presentation, however, I just wanted to take care of a few housekeeping points. Everyone will remain on listen-only mode, which means you'll be on mute. Should you have any questions, you can simply type them into the question panel on the control panel that you'll see in front of you. And Evan will answer your questions at the end of his presentation. But you can ask a question at any time. Also, we will record this webinar and it will be placed on our webinar library page and also our YouTube page. And if you haven't checked out our website already, it's www.needymeds.org, and we have tons of resources and information about programs that can help you save money on your healthcare costs. So without further ado, I'd like to turn the conversation over to Evan. Again, he is the project manager for Healfundr, and he's going to teach you the ins and outs of this innovative crowdfunding platform. So take it away, Evan.
Thank you very much, Lori. Hello, everyone, and thank you for taking the time to learn about NeedyMeds' unique crowdfunding platform, Healfundr. Our mission at NeedyMeds has always been to help people facing problems paying for medications and healthcare, and the rise of crowdfunding has opened a lot of doors for those in need. For those unfamiliar, you may be asking, what is crowdfunding? Crowdfunding refers to the practice of collecting many small donations towards a larger single goal. Kickstarter is what comes to mind for most people when discussing crowdfunding. It's a site that helps people fund creative projects. Kickstarter projects offer rewards for pledged donations, most often a copy of whatever creative work is being funded, be it a film, musical record, what have you. However, there are other platforms that are used for charitable or human interest campaigns, anything from recovering from a natural disaster or personal tragedy to funding honeymoons. Since 2008, over $100 million has been raised through charitable crowdfunding. There are now over 500 different crowdfunding platforms covering everything from creative works, charitable organizations, and even equity investments. With so many different platforms already available on the online marketplace, why have we developed yet another? Healfundr is unique in several ways, taking what we feel is the next logical step in crowdfunding for medical expenses. We verify 100% of our campaigns, something not offered by any other crowdfunding platform local to the United States. Other crowdfunding platforms are self-policing, in essence allowing the users to flag fraudulent or inappropriate campaigns. We take the guesswork out of whether a need is legitimate, so donors don't need to worry about losing money to a deception. Funds collected through Healfundr are paid directly towards medical expenses. Other crowdfunding platforms send the money directly to the campaigner. Most platforms state in their terms of use that they are not liable for any misuse of funds donated, as once the money is in the hands of the campaigner or beneficiary, there is no guarantee the money will be spent as described in their campaigns. With Healfundr, every dollar raised is used to pay bills directly, so there is never any question of whether the money gets to where it's needed. Funds exceeding the financial goal are designated by the donor to go one of 5 different ways. 1, go to the beneficiary as cash. 2, the donor receives a prorated refund. 3, donor receives a credit usable on Healfundr to donate to another campaign of their choosing. 4, the money gets split between campaigns fighting a specific diagnosis, supporting patients in an affected area. Or 5, donate the remaining funds to NeedyMeds. Other crowdfunding platforms that allow for a goal to be surpassed send the money to the campaigner, who is under no obligation to spend the money a certain way. And of course, all Healfundr users will have access to NeedyMeds information and resources. Our aim is to give everyone who needs it the power to heal. Medical bills are the leading cause of bankruptcy in the United States. Lack of funds can prevent people from seeking out a doctor or buying prescribed medication or skipping doses, leading to potentially worse financial and health problems if their condition were to worsen. According to a 2011 study by the National Bureau of Economic Research, nearly half of American adults said they wouldn't be able to easily produce $2,000 in the event of a medical emergency. It's with all of this in mind that we've decided to give the power to you. You can harness the power to heal yourself by raising money through your own campaign, or you can use that power to heal others with the power and scope of the internet. Here's where we'll walk through the basics of Healfundr and how it works and how you can take control of that power. Again, anyone just joining in, if you have any questions, feel free to type them into your question control panel, and I will answer as many as I can at the end of the webinar. Creating a campaign is the first step to utilizing your power to heal. Anyone in the U.S. or its territories with legitimate medical expenses can sign up to apply for a campaign. It can be dental, mental, any kind of health issues we can help you out with. In the interest of helping as many people as we can, we don't put any limits on insurance status or income level. Anyone in need can apply. To verify campaigns, we require a letter from a diagnosing or attending doctor. In case we have any questions, we also ask for a release form allowing the doctor to discuss the patient's health care with us at NeedyMeds. This extra step ensures no funds will be misappropriated or used fraudulently. Nonprofit organizations, medical facilities, and medical research teams can also apply for a campaign to support a community stricken with a medical condition, purchase medical equipment, or other related costs. Your campaign page is where you can tell your story, post pictures, and share updates of your treatment with those who helped make it all possible. Donors can leave words of encouragement at the time of their donation and see how much of the goal has been funded. This is where you'll be able to direct your friends and family on social media and the link they'll share to spread the reach of your campaign. Medical bills requiring payment need to be uploaded using the Healfundr website, where they will be approved and paid for by the crowd-raised funds. The beneficiary only receives direct funds as designated by the donors if the financial goal is exceeded. Bills will only be able to be paid when the campaign has raised enough funds to cover the cost. We'll coordinate with the beneficiary and their service providers to determine the order in which bills are paid. Campaigns can be held in many situations. Individuals can use Healfundr to cover unpaid medical bills, purchasing durable medical equipment such as wheelchairs or other assistive devices, or financially help those with a chronic condition or experiencing a medical emergency for which they're not prepared. Healfundr is still in its beginning stages. We just started back in January, and as our mission is to simply help as many as we can, any and all medical expenses are applicable, and anyone in the U.S. and its territories is eligible to apply for a campaign. Organizations can also raise funds on Healfundr. For example, a nonprofit could fund a charity golf tournament to support a local community suffering from a specific condition, or a clinic or hospital could fund an MRI or other needed equipment. Donors can even have a hand in funding researchers developing new treatments for diseases. In fact, NeedyMeds is partnering with RX Outreach and using Healfundr for a first-of-its-kind generic medication assistance program that we call GAP. Offering nearly 20 generic medications at no cost to those who qualify, the campaign also has a special matching program where each donation will be matched dollar for dollar. Eligibility requirements for GAP are to have no prescription coverage for the needed medication, be at or below 100% the federal poverty level, and to be a legal resident of the United States. All donations up to $50,000 will be matched, functionally doubling donations made to the campaign with this unique new program. For information on GAP, more information on GAP can be found on the NeedyMeds website. Donating to Healfundr campaigns is quick and easy. Donations can be made with credit or debit cards on Healfundr, processed by authorized.net, or by mailing a check to NeedyMeds with the printed payment slip. Donations made by credit card are subject to a small processing fee through authorized.net, as well as a sliding scale administrative fee from Healfundr. Check donations will not be charged a processing fee. Managing your campaign is also efficiently done through the Healfundr website. Here is where you will submit medical bills for payment, as well as upload any additional supporting documents needed for approval. It's also where you will write and post updates on your treatment and the campaign as a whole right to your campaign page. Donors who have selected to stay updated will receive the update in an email. You'll be able to change or add photos shown on your campaign page. And lastly, you'll be able to see a complete list of your donors, their comments, donations, and an option to send a personalized thank you letter. We at Healfundr will adjust the financial goal to cover the cost of all medically relevant bills and all associated fees. We may even be able to lower the total needed through medical bill mediation. As you can see, Healfundr is truly a unique in the realm of crowdfunding in several ways. We are the only US-based crowdfunding platform to verify 100% of our campaigns to protect our donors from being deceived by fraud. Crowd-collected funds will be paid directly to the service providers to cover bills, whereas other platforms send the funds to the campaigner, who at times is not even the person in need. Due to our nonprofit status and low overhead, we apply a sliding scale of fees to donations. 5% for the first $20,000, 3% for the next $30,000, and 1% on the remaining funds collected. Under no circumstances will campaigners ever pay any fees out of pocket. We will adjust the financial goal to cover the cost of all care and fees. Other crowdfunding platforms apply a flat rate to all donations, usually between 4 and 12%. It's up to the campaigner to set their goal, keeping in mind all the associated fees. Healfundr donors designate a use for funds that may exceed the financial goal of the campaign, whereas other platforms send all funds to the campaigner, who may not have a plan or obligation to spend the extra funds in any way. With over 16 years of connecting people with patient assistance programs, medical bill mediation, and discounts on prescriptions, we at NeedyMeds have an ever-growing database of resources that can further assist users and even lower the campaign goal. As a NeedyMeds project, Healfundr is entirely owned by NeedyMeds and operated by its employees. We at NeedyMeds hold ourselves to a higher standard of attention and care and are more than happy to spend extra time with the user coordinating their campaign or need help navigating the site over the phone. We will share campaigns on our own social media pages, but the largest impact will come from the campaigner and the beneficiary's own networks. The NeedyMeds helpline is also available for all users, potentially connecting the user to more resources to help cover medical expenses. Users also have access to the free NeedyMeds drug discount card, saving those without insurance up to 80% on anything prescribed by a doctor. I want to thank everyone for attending today. I hope that we continue to get the word out and are ultimately able to help a lot of people with Healfundr. If you or someone you know is in need and interested in using our new program, or if you have any additional questions, go to the website at www.healfundr.org or contact me directly. I'm Project Manager Evan O'Connor. I can be reached at NeedyMeds, at evan@needymeds.org, or on the NeedyMeds business line at 978-281-6666. Thank you, everyone. I hope everyone learned a lot today. If anyone has any questions, feel free to enter them in now, and I will get to them as quickly as I can. I'm hoping everyone can hear me all right. Don't really see any questions coming in.
I have a question, Evan.
Sure, Lori.
Can people use this for funding cosmetic procedures for medical?
Cosmetic procedures, I would obviously have to check with the president of NeedyMeds. He has the last word on everything we raise here, but he has been very open to everything that has been suggested. We have people who raise funds for orthodontry, dentistry, mental health, anything that people really need. Someone asked if we can have funds requested for non-traditional treatments such as acupuncture and herbal treatments. We say that anything FDA approved will absolutely cover. There are things that Dr. Sagal likes to research before we approve them, Dr. Sagal being the president of NeedyMeds, but he has been very open. If there's any other questions, feel free to post them now. If anyone can't hear me, we will be posting the webinar on the YouTube by the end of next week. And if anyone would like copies of the slides, I can also send them that online as well. Someone asked, is transportation for seniors to see doctors allowed? Yeah, absolutely. Something we can definitely have help fund with Healfundr. It can be included in the price, especially if there's other things needed. Somebody asked if they're in a group starting a free clinic for the uninsured, and have we worked with other free clinics? Healfundr has not currently worked with any free clinics, but we definitely have that capability. If you need help raising money to get more equipment, to help pay your doctors, to help get community outreach, we can definitely work with you to get stuff, get funding going for that. And yeah, home repairs we absolutely help too. If you need ramp for a wheelchair or vehicle modifications because you become disabled for whatever reason, we can definitely help with that. Somebody asked, how do we vet the doctors who are verifying the diagnoses? We trust doctors. Our president of NeedyMeds is a doctor himself. So he definitely goes through a bit of a, if something he's not familiar with, he definitely does a lot of research before he comes to a conclusion. But the conclusion is almost always favorable. I've never heard him come up with something that wasn't, he said no to, unless it was something that he felt was trying to take advantage of somebody else. Somebody asked if we can assist with medical cost mediation. We do have a third-party corporation that we are partners with that we can help reduce the cost of their medical bills. The third party has certain restrictions that we can't really pass, but as long as it's a medical thing, they don't help cover mental health or substance abuse problems and other things like that, but we would always help fund those things regardless of whether we could get the medical bill and the mediation. Somebody asked if we would help with a nursing home stay or an assisted living facility. Absolutely. Those are all things we could definitely help fund with Healfundr. Crowdfunding definitely works best in your own personal networks, but again, we do share them all on the NeedyMeds and Healfundr social media pages as well. Looking for more questions. I think that's most of them. Oh, here are some more questions. Someone asked that they require liver transplant patients to have around $5,000 saved for lodging and post-transplant recovery. Would this type of deposit savings be something that the platform could support? It would absolutely. If it's something, crowdfunding can put a little bit of strain on time-sensitive things because the money doesn't always come as quickly as people need it. But it's definitely something we can work with and help fund if that is something that is needed. Somebody asked if there is a tipping pool that must be raised before the amount is given. For example, 50% of the received. So we need to have enough money in the campaign account to be able to pay certain bills. So if somebody has many bills and their campaign total is for, say, $10,000, but they have a medical bill for $1,000 and there's more than that in the account, we will just pay that bill as the money becomes available. Again, we do coordinate between the beneficiary and the service providers to see if there's some that are more time sensitive than others. Somebody asked if we've had any success since launching. We have a couple campaigns currently going other than the GAP. We have someone funding their child's dental work and somebody else looking for osteo treatment, I believe. We've been raising money for them. No campaigns have been completed, but we're still looking for people to sign up to make more donations, to make more campaigns and get those supporting documents ready. Somebody asked if they have a family in need of getting a van for a child due to a recent injury. That is definitely something Healfundr can help with. We can help fund the special vehicle. We can help maybe locate a dealership that may be able to give them a better price if that's something that we could help with, like in their area. And Somebody asked, as a 501c3 that helps cancer patients, can they crowdfund their organization for operating costs? Again, yes, as long as nonprofits can raise for their organizations to help with their missions, all sorts of things. Also medical facilities, individuals, anybody can raise, so long as it's for a legitimate medical reason and you're helping people out. And somebody asked if co-pays for skilled nursing stay, is it covered? It's something we can definitely help out funding. We don't really have any restrictions on whether it's medicals for children, seniors, dental, mental health. As long as you need help, we'd be happy to help host your campaign where you can raise the funds. And do the funds qualify as charitable donations through Healfundr? And if so, do you send out a receipt for their tax purposes? The easy answer to this question is it definitely depends. Mostly it will not. The way the IRS defines tax-deductible donations is that if it is directed towards an individual or a family, it will not be tax-deductible. In the case that it is tax-deductible, say you're donating to a nonprofit who's holding a campaign, or you just donate X amount of dollars to whoever we feel needs it the most on Healfundr, which is something we've been able to do, those would be tax-deductible and we would send out receipts. There are receipts for all donations made anyway, but in the case that it's a tax-deductible donation, we do our best to get people the tax receipt as well. And last question, I think looks like we got is, if someone is interested, should they just jump in and start a campaign or give someone a buzz first? If anyone has any questions, I am more than available by email or by phone. And crowdfunding can require a bit of setup. Just knowing what you're doing is definitely a big help. But we can always help you through the situation there. All right, we did get one more question, and they say it's a tricky one. They said Colorado has legalized medical marijuana. Could funds be requested for this treatment? We actually had a question about this just a couple weeks ago, and I ran it by the president, Dr. Sagel, and as long as it is in a state where medical marijuana is legal, it is something we will be able to work with you with. Well, it looks like that is all the questions we've had. I want to thank everybody again for attending the webinar. If you have any questions, you can email me at the email address you see on your screen, evan@needymeds.org, or call me at the number 978-281-6666. I hope everyone learned a lot today, and if you have any questions or would like copies of the slides, go ahead and email me. All right, thank you all very much. Have a great day.